Hi, I'm Mario Evon, and you're listening to Talk Truth, a weekly edutainment podcast discussing the things that most people are afraid to, but from a Jamaican perspective. From relationships, sex and sexuality, to the ins and outs of entrepreneurship, in this space we speak about almost anything with the intention to inspire, educate, entertain, and create a fair and balanced space where your truth shall become your power and set you free. Undeniably one of the most powerful things on the planet, and Jamaica and Fiwi dancehall culture has not been shy about idolizing it. The neglai, the glimity glamity, the glow, the gumshan, the punani. Jamaica has fully put itself behind the power of the pum pum. But are all vaginas made equal? This is episode number 2, and I have with me Dr. Wendel Guthrie, obstetrician and gynecologist, and we're going to unpack this one. But before we get into the podcast, I just want to show some love to our listeners who gave us reviews on iTunes. Car683 titled Talk Truth. Well, Mario Evon, you have managed to add another hat to your beautiful head. Podcaster, is there anything me cannot do? I think not. Awesome intro into what to expect from Talk Truth, and I'm sitting on my hands looking forward to more as the weeks progress. We have Dre Tav who says, congrats, I'm excited about this podcast. Kudos to you, Mario. Looking forward to the great content you'll be presenting. And our third review is from BV1987 titled Subscribed. First episode already feels fresh, fun and interesting. Looking forward to more episodes. Thank you for those 3 reviews, and I encourage you guys to go on iTunes and rate and review the podcast because it really helps to put us high up in the ratings. We'd appreciate it. All right, let's get to it. Boom boom time. All right, this is going to be my first full-length episode, and I'm really excited because I have someone who I admire and respect very much, and he's going to help us deal with this topic. Are all vaginas created equal? And beside me, I have none other than consultant obstetrician and gynecologist, Dr. Wendel Guthrie, who I oftentimes call Dad. So welcome to Talk Truth.
Thank you very much for having me.
Now people are going to actually hear how similar we sound on microphone, which is going to be interesting. So what I want to ask you, all right, so I'm a young boy now, so tell me back in your day, what were some of the names that you remember them having for the vagina? I mean, in my day and age now, I know Jamaicans call it pum pum, them call it chocho, they call it all sorts of things. Maybe there were some before my time.
Yes, well, it depends, because when you spoke to the little children, they allow it to sound more like kitty and cat and these little things. And when you...
Back then or no?
Even back then. And then when you get to the older person and you hear people talk about fanny, right? And
in Jamaica?
Right, in Jamaica, because some of that came from British, where they talk about fanny. Then you also have the people degrade it and talk about pussy, right? And that is what is there. The problem is that female, what they call vagina, is not what the gynecologists call vagina, because we are at an advantage as male in that we can just look at our penis and feel our testicles and all
see
that,
everything that's down there.
and see everything, but women only seeing the external aspect,
right,
which from a biology point of view, anatomy, we call that the vulva.
Well,
and the vagina.
Right. I'm glad you're going there because that was my next question. Tell me about the anatomy. So the outside part you say is
yes, and
the vulva.
The vulva, but that part is if you start from the top where you have the hair going, it is what is called the mons pubis.
Right.
But making up the vulva, you have the clitoris and you have the outer labia, which is the thicker part.
That's the labia majora.
Yes.
That's the fat part.
Yes, that goes here. And you have the inner labia, that is a thinner area. And it's almost as a a flap valve effect, because these overlap, especially when people have on clothes and the outer part will come together.
What is the purpose of it? It protects the opening?
It really protects, because the vagina has different levels of protection, other than the fact that it has an acid pH. When somebody is sitting down, the vagina is not an open passage. The walls come together from back to front,
well,
so it is closed.
So it's not open all the time.
No,
so
not
open. The walls come together.
I mean, you can use your mouth as an example. When you're not speaking, you can feel your tongue touching the roof of your mouth. So your mouth is basically a closed potential space. Now the vagina is also closed from front to back. And then at the entrance, the labia minora, which are the thinner ones, right? They imagine you have on your clothes, your bath suit, your panty. They come together and almost overlap like a valve.
So that is kind of really the protection. Then.
Really protection. And then now, the thicker area comes together and meets in the midline, so that there is a front to back groove. And so when you look at age groups, when you look at little babies, all you see is the two thick areas meeting. And if you don't spread these areas, you don't see things like the clitoris and the inner labia. Well, when people get in older now, it is easy, as there is development, to see the full structure. So there's a good protective mechanism there. That's why if you have on your bathsuit, or if you don't, and you jump off a springboard and your legs open, water will not go up inside your vagina.
And nor will vaginal fluids come out.
Come out, because there is a good mechanical barrier there.
I want us to complete anatomy, then I want to come back to the labia. So the all right, so outside of the labia and the vulva, everything on the outside, when you go inside, it's just, is it muscle?
Yes, it is. The vagina actually is really a tube that connects the entrance, which is where the hymen is, for somebody who have never had intercourse.
Right.
So the hymen is the opening. The hymen is not closed off, but different hymen have different caliber. So some people cannot put in a tampon because it's so tight, and some people who are virgins.
But that is when the hymen is gone, though, right? So
no, you can still put in a tampon when the hymen is there, because there's a certain degree of stretch that takes place. And the people who manufacture tampons, they also make tampons that have plastic covering that slides in very easily.
Right.
And so a lot of young women are afraid to use tampon because they believe it is going to affect their virginity, which is not really true, because suppose you're a swimmer, it is the best thing to do if you're a swimmer to use tampon. If you're a track and field athlete, it is a good thing to use tampon, because it's not necessarily comfortable to swim in pad or run in pads.
And all right, fine. And why is the hymen there? Why do you think they created the hymen? Why God created the hymen?
No, it is not that the hymen is created for any purpose. It's that the vagina is designed, the anatomy, the embryology from development. There's an upper vagina and there's a lower vagina. So the upper part, two tubes come together that are called the Mullerian duct, and they come down and they run side by side, and the partition in the tube will hollow out. Now the lower vagina is a part that literally is an invagination. It turns in from the outside, and it is where the inner part meets the lower part that turn in, right? That is where you have the hymen is formed. So in some
anatomy,
cases,
it's like a remnant from the...
Exactly. And in some cases, which is abnormal, you do get an imperforate hymen. So when a girl gets to the age that she should start have her period, she might feel a sensation month after month, but there's no flow because there's no opening.
All right. And at the top of the vagina now, we have the cervix, right? Which is the beginning of the uterus.
Yes.
Cervix is part of the uterus, right? That we call the womb.
Yes.
All right, good. So we have the anatomy. So there are no bones in the vagina?
No bones in the vagina, but the vagina walls have folds more like an accordion. pleats.
Right.
And
right.
so that allows it to stretch any direction. Because, for example, when a baby is coming out, if it's a 8-pound baby or 4-kilogram baby, it will stretch right laterally to the pelvic side wall and come back. Similarly, on the other hand, the resting vagina is just about 3 inches long, but if you have an erect penis, 7 inches, it still will fit just the same during intercourse. So there are folds, and it adapts, and then those folds will decrease and the whole thing becomes smooth
as they get older.
At menopause, and say women in their 70s and 80s, it becomes so thin that sometimes there's no room for stretching. But the younger person, all that room is there for sex, for childbirth, etc.
All right, let's come back out to the outside. So in Jamaican culture, I think there's this obsession with fatness, and the fatness is determined by the size of the labia. So you see somebody in a tights or something, and they're looking at, well, I guess the connection is between the outside and the inside of the vagina, that if the meaty part on the outside is fat, then that must tie into the
More
inside being pleasurable.
Yes, well...
How you feel about that analogy?
That analogy has been around a long time. As a matter of fact, in the dancehall culture, they used to have a thing they call a buffer zone, where women wear their bath suits, and the ones who had the most bulge, they won the competition, right? Sometimes it is the amount of hair they have, but it varies from one person to another, because a fairly fat person might have a fairly flat labia, and a fairly slim person might have, because sometimes what is happening, the pubic bone above the clitoris is very prominent in some persons.
And that might be causing the bulge.
And that might be causing the bulge.
But I feel like you can differentiate between a bony bulge from a soft bulge.
Yes, you can differentiate. And it is true that people talk about fat labia, but that doesn't mean there is more pleasure in the vagina as far as sex is concerned, because other things cause pleasure, such as dryness or moisture or being prepared. So if somebody is not prepared for sex and say they are raped, there's hardly any secretion at all.
Right.
And so there is dryness, everything. Well, if they are in the mood, they might have so much secretion that it might even run down the leg.
I like the direction you're taking us. You said something important. I mean, really and truly, at the end of the day, we're going to come to the conclusion as to whether all vaginas are created equal, or some tighter than others. But you were talking about size. So should I assume that a bigger person proportionately will have a bigger vagina? So if you're 4'6", and you're tiny, does it mean your vagina is like 2 inches? And if you're like 6'1", then your vagina is like 4 inches? I mean, is that logical?
People's body tend to be proportional, but the vagina is not really exactly like that, because you can get stretch after childbirth, and so. But let us not go there yet.
Pre-childbirth.
I like to look at the vagina like you have 2 yards, right? 1 yard has a little gate, but it's the same side as the yard next door. And so the little gate, only pedestrian can walk through it. So the muscles around the entrance of the vagina, called the levator muscle, can be fairly tight in people who have not had babies, and so on. On the other hand, you have another yard next door, and you have a big gate, so you can drive a bus through, right? So, but the actual vaginal passage is likely to be about the same, but it is the muscles around the entrance, as like the gate column.
And the muscles will vary from person to person, irrespective of their external size, but it's still within a close range.
Some people can get the muscle a little tighter than others, which I'm sure we'll come to.
Right.
And some people will have it stretched like after delivery, and there might be tears that leave some sort of looseness and all of that. But basically, by design, you can, why do you see a big basketball player with a little 4'10" woman, and people wonder
how they make it happen?
How they make it happen. But so the vagina is designed to accommodate.
But I'm sure in another podcast I'll tackle the other end of this, which is penis size. But I have a feeling that in men, penis size in some instances may be more proportionate to size, but it may not be so either, because genetics may play a component in that.
Penis size, there's a misconception too, because penis size is related to erect. And so there are some people who have a little shrunken penis, like a little finger, right?
In our days, we call them growers versus showers.
Yeah, but when they are erect, they are the same size as the man who has this big thing hung down in his pant. In other words, the proportion of stretch in the little one might be much more than the proportion of stretch in the big one. And some persons even believe that the very big ones, since it is blood that you have to pump in the penis to maintain an erection, and that a big limp penis do not get very erect because you can't supply the amount of blood to keep it firm.
I like where this is going, but that was actually my next question. So we've dealt with the size of the woman. So basically, the levator muscles mean that the vaginal entrance could be about the same in a big and a small woman, right?
It could be about the same, and then you could do exercise to tighten the levator too.
Do you feel like the perception of vaginal tightness may be due to penis size? So in other words, a man with a bigger penis would therefore think the vagina is tighter because he has a bigger penis versus somebody with a smaller penis. I guess that may make more sense irrespective of the stretch.
All right, that's a good thing. A lot of men will tell women that they lose, but a lot of these same men are men that losing their erection, so they're getting soft. So you have two sides to the coin. You have a square peg and a round hole, and so it don't fit as well as it should fit. So you find out that a lot of men will tell women that they lose, and in truth and fact he is a person who is getting soft.
Right.
But men are macho and do not want to own up to that, right? So they will do that. And so the fact of life is that many times when women come to me now as a gynecologist, I've been practicing for over 40 years, as you know, and they say they are loose. Like I tell you, and you examine them, and you say this woman is no different than anybody else.
Right.
And sometimes you even ask them to contract their levator muscle, and you they squeeze your finger. So you know that nothing seriously is wrong.
Right.
It is a suggestive thing that there is somebody sometimes that tell them
that they are loose and brainwash them into feeling
and
something goes so.
Of course, nothing was wrong with her really, but she has been carrying this baggage.
Right, that is
for
more of
so long
emotional
that
kind of burden.
She's sure something is wrong with her.
But she was okay.
And then you're able to. She don't need no medication. She's not having a discharge. She need good talk therapy. Nothing is wrong with her. So the perception is there, you know.
So what about normal size penis, but the female is very, very, very aroused and producing a lot of secretions, in which case, no, I guess the tightness is not as much because there's so much.
Yes.
So that can happen as well. There's less friction because less contact.
Because if there's a lot of lubrication, I mean, you might not feel
the same sensation.
Sort of contact.
All right, well, we've done a lot of the anatomy and the scenarios. Let's talk a bit about non-surgical ways that people have tried to, or even tried to make the vagina tighter. So I grew up and I did hear about alum powder, which some of the young people will know about. What's in it? Magnesium, isn't it?
Yes.
And alum. What is the theory of alum and how you use alum?
It used to be something, and maybe still is, that used to be used chiefly after women deliver. And it is, in theory, it's supposed to shrink and tighten the vagina after you have a baby to bring it back to normal. So whether it is a taboo or not, right? Nobody knows, but it used to be preached a lot, and people still use the alum. And you can get it in forms that is semi-solid so that it can be inserted.
Okay, I was wondering if you sit in it like a sitz bath and soaking it.
You can get that sort too, where you sit bath. But sitz baths are really not so much a vaginal tightness.
To heal up
they are
bruises.
To heal bruises and tears, and when people get cut and get stitched, like during
episiotomy when you're delivering, or you just have tears
and so on, and that is to help the healing process.
Right.
Funny enough, these things all go way back, but the area around the vagina it is almost a miracle in that it is so vascular. Not a lot of people get big tears and go about their
vascular
business.
for y'all means they have a lot of blood
supply.
vessels, right? So that it may heal faster.
I remember being actually...
It bleed easier, but it heal faster.
Yes, and a lot of people get torn and they're so scared about being stitched. They just go about their business. And when they come back at 6 weeks with clinic, you don't see any tear at all. It heals very well on its own. And so there are even questions. I remember looking at a study out of Scotland that said that if a lady didn't have a big tear that goes right into the anus, they don't need any suture in. And the truth is...
Right, if it doesn't go that deep, then they can probably let it heal.
They can, because when it goes that deep, it tears the muscle that around the anus.
Right, and that's
so you can get
problem.
anal incompetence and all of that, and stool always soiling. So you definitely fix those. But most tears that are superficial, it is just that people get used to stitching them, because guess what? When you are sitting down, you walk and everything, that area is so close together that the edges of the tear just oppose itself.
Right, they're close and they heal.
So except you're going to be spreading your leg like doing gymnastics.
Then it will heal.
It will stick together and heal on its own.
All right.
Yes.
And are there any other substances outside of alum that people have referred to for tightening?
Alum is the main thing, but in recent times there have been a lot of so-called, I shouldn't say so-called, reports and methods to do vaginal rejuvenation. And what they are instruments. Some of them are lasers, or that they're inserted in the vagina. And what they actually do, they can cause some scar tissue to narrow the vagina.
This is still non-surgical though, right?
It is.
It is
not surgical in terms of cutting,
right?
But they are things that you can use. And so people use things like electrical stimulation. So just like how people would have dildo that they use to stimulate outside, they can put stuff in the vagina to stimulate muscle activity, right? Which is almost the same like if you do Kegel's exercise.
That's the next question I was going to ask. So,
which is intentionally contracting the muscles around the entrance of the vagina, which you call the levator muscle.
I hear it's like squeezing to stop your urine, is what they describe it as.
Yes, it is. A lot of persons, I mean, Kegels fails frequently, because if you go to the gym and you keep lifting a 5-pound weight and you do 10 reps or 3 sets of reps every day, your biceps will get firm.
Right.
Now, most people will not remember to do 3 or 4 sets
Kegels
of Kegels a day. So
unless you're really determined.
Yes, so people say you should contract the pelvic floor muscle, and it is, you'll say, like cutting urine, but it's the same muscles you contract. Suppose you're passing your stool and you want to cut the stool, right?
Right.
That is the same action. So you do that same action and you do repetitive. So in order to get benefit, it is usually suggested that you do 3 sets of 10, 3 times a day for at least 3 months.
Wow,
so the 3 easy to remember, but you imagine you sit at your dining table having
3 sets of 10 3 times a day
for 3 months
for
at
3
least
months
to start feel a difference.
Wow.
Right. So this is a nice.
That's harder than my current workout program.
Of course, that's a nice mnemonic. And if you ask any patient,
3 times a day for 3 months.
Yes,
three.
If you ask any patient, they forget, because you could tie it in with activity, or you could have a little alarm clock. Something like that, like our phones have alarm now.
I'm sure you had some diligent patients who did it all the way for the 3 months.
You can go longer than 3 months now. It's
of
like
course,
how people go to the gym for life.
Right.
So you can do it all the time. But in order to get going, that is a good thing to remember. 3, 3, 3.
Right.
So you sit at your breakfast, you having your at the table,
so you can do it at your meals.
You having your breakfast, right? Or you're at the stoplight waiting in traffic. Right?
A good time.
And you do a good 10, right? And so on.
If you're overzealous, you can do 20.
Or lunchtime, you say, is another time to do it. And supper time or bedtime, you say another time to do it. And people even go further and say during intercourse, you try use the levator muscle to squeeze the penis. The trouble is that some people concentrate on the sex so much that they forget to
enjoy the sex.
To contract the muscles at that time.
Right. I realize you added a S to Kegels. Is it that's apostrophe? Is Kegel a person?
Yes, Kegel.
J-E-L. K-E-J-E-L.
And then that is it. And then your apostrophe is.
All right. Well, all right. So let's move into things that maybe the average person won't know. There are some times when women need to surgically tighten. I'm guessing some of it may be cosmetic, which might be a vaginoplasty. If your labia is too fat and you don't like it, it hang down and you want to chop it off, which people do, right?
People
and then
do, but I'll tell you a little
there are
bit more
medical
about that.
reasons. Tell me about that first. About
there is a journal that was published not too long ago called Reproductive Health, and on the cover, front and back cover, it showed no less than about 200 variation of labia. So people do come to you want to trim the labia because they watch Blue movie and they see some
neat
thin labia, which is usually thinner in white persons.
Right.
And then you see somebody.
So people need to embrace their black labia.
Exactly. So then
embrace your African labia.
Then if you go into the Louvre, in the big museum in Paris,
right,
there's a whole female labia that is displayed because it is fat with big labia, and people have gone there to look at it, and people have gone there to protest that it is disrespect to people. No,
right, it's offensive to display a labia because there are people who really have labias that look like that.
Because people do have like that. So, because of the fact that in a lot of cultures they do female circumcision, and female circumcision take you from sometimes remove simple things like trimming in the labia minora to extensive things like cutting off the clitoris, cutting off some of the labia. And so I remember many years ago, in UK, I saw one in the clinic, a girl from East Africa, and the whole area was scarred as if there was a burn. And you see two openings, one opening that urine come through, and the other opening that periods come through. And the regular labia, as you know it, was not there. And that is traditional female circumcision that is seen as a rite of passage.
Right.
But in the Western world, in
which countries you were saying for female circumcision? Even
a lot of African
countries, right?
But this particular case I was telling you about was from Sudan, but they have it all over. But female circumcision is what it is called, and it is tradition. And even the girls that are going to get it, some of them are looking forward to it. But it is done by some old lady who have experienced the cutting, and some places they call it cutting. They don't call it. So
those girls not even concerned about vaginal tightness because they're not really supposed to be having any sex, right?
No, and they're not supposed to get pleasure, so that's why the clitoris was removed. They're supposed to just have babies, right? However, when that heal and scar, it doesn't stretch easily. So during childbirth, they get awful tears because you have dry tissue.
And that could put them at greater risk of bleeding as well, eh?
Hemorrhage and the procedure itself, they have been known to bleed to death when they have the circumcision done, and also to get infections.
Sounds like an awful
and
thing.
so they call it female circumcision, and these people say it's their right to passage. But in the Western world, and like the Royal College of Obstetrician Gynaecologists claims that it is called FGM, right? And female genital mutilation.
Right.
Now, for people who believe it is a right thing to do, the word mutilation is really disrespecting their culture, right? However, having said that, the Royal College of Obstetrician and Gynaecologists say even we who are registered gynecologists shouldn't trim labia.
Oh, yeah.
Oh, yes. And you could go.
And that's Royal College, which is out of the UK.
Out of the UK. So you even...
because they say it's a type of mutilation.
It's a type of mutilation. So when a lady who has big labia come to you and ask you to trim it for that reason, you need to tell them that from my training, I'm doing something that is illegal.
It's not technically illegal in Jamaica though, right?
No, it is
We
not.
have no laws against it.
It is not technically illegal in Jamaica.
And if the patient requests and desires it, I guess you as a surgeon could
yes, you could do it.
Right.
And I have seen labor that's so long that when the women are having intercourse, it fall in and irritate, and so I have done trimming, but I usually have done more counseling to tell them that it is unnecessary, and so they might come want it to be trimmed, and I talk to them and I don't see them again. Either A, that I was able to convince them, or B, they go to somebody else who will do it. Right?
Well, all right, this is a good time to now go into a few other things that I say maybe the average person won't know, but unless you're a woman who experiences it, and I've seen you do this a few times, and that is women who have prolapse of the uterus, or they have the bladder prolapsing, right?
Yes, the sister seal,
and
they have rectal seal.
Sometimes in repairing that bladder, you end up tightening the vagina, right?
In most cases.
Tell me a little bit about that. I mean, what is the prolapse anyway? What we call it in the body come down?
Yes, they call it body come down. And what it is really, it happens chiefly in women who have had children. When I was in training, they used to say if you have a lot of children, but you can have one child and
you still get it because the muscles get weak. So it's really about how your muscles respond.
Not all muscles. There are some ligaments that suspend the uterus, and some go to the side, to the pelvic side wall. Some go to the back. We call them uterosacral. To the side, you call them cardinal. To the front, you have round ligament, and all of that. These get stretched and did not go back. No, just like how some women have babies and they are loaded with stretch mark, and don't care what they rub on it, they still have stretch mark. So it means that you have an inherent deficiency in your elastic tissue.
Right.
So people with good elastic tissue might not get prolapse. So you explain to the patient that what you're really doing with the prolapse, you're going to correct it. But what is left there could prolapse because you can't give them new elastic tissue.
Right.
So I remember, again in UK, a lady asked the consultant, so how come I get prolapse? And the consultant stopped a little and said, you ever have an old drawers and the elastic way out? And it just dropped down.
Right.
And so, of course, I was glad that it was nice.
So that's a good analogy.
I wasn't the person who said it because it might have been offensive.
That's a great analogy. When you have an old drawer, it's nice and tight for a while. But you still wear it because sometimes you like it.
But
before, what is the average age though that most women? So that's another thing. What happen when you're older generally?
Yes, when you're older, you get a few prolapses that occur like in relationship to things like pregnancy. And so you get some women in pregnancy get prolapse during pregnancy. As the pregnancy get bigger, the prolapse decrease because the uterus get large and pull up the cervix.
Right.
So you don't see, but after delivery, it comes back down. So you get a few of those. Most of the persons with prolapses are postmenopausal women because the elastic tissue will deteriorate when the estrogen hormone level falls after menopause. So they are more likely to get these prolapse, and they can be huge, and they have a lot of things in Jamaica. They call it body come down. I remember working out in the clinic in the country, and one lady come and said, "Doctor, I have tomatoes because it looks so big and red like a tomato." And
I love our people. You know?
And another lady, she told me after, just like I told you, showed me her prolapse, wanted to do surgery, wanted to find out what caused it, and I went through the nice explanation about elastic tissue and thing, and she paused a little bit. She said, "Well, my church sister said that when my husband dead, I never wear no red panty, so him come back, come play with me and give my body come down." Right? Because red panty is supposed to run
supernatural,
ghost.
yeah, red is for the supernatural.
Yeah,
even in the movies,
yes.
the red thing for the baby hand.
Yeah, so I of course I said to her that, what about the women who have prolapse and their husband not dead?
Exactly.
You know. So this but back to your question.
No, but all right. So in the case of the prolapse, you fix the ligaments, the muscles, you tighten it.
You
so
tighten
the
everything.
vaginal tightening at the end of that procedure is not really holding the womb up. That's just part of
No, it's not holding the womb up.
Being a
It's
part
of the whole procedure. And so the part of the vagina that was pushing out, for example, the front section, very often is the bladder is pushing out. And the rear section sometimes is the rectum that we call a rectocele. And then the womb prolapse is when the cervix comes down. So very often when you do all that repair,
right,
people can still have intercourse, except you really over repair it.
So can a woman who is not having a prolapse still have that same kind of vaginal repair? If you still surgically tighten
yes,
it?
there was.
And is there any real indication, or based on what we're discussing, your vagina should be good, so what would be the reason for it?
The indication is usually the perception of some women that they are very loose.
Right.
And sometimes they
might be a little
sometimes they feel loose, but sometimes it's somebody tell them that they're loose. So it is always suit you to ask questions. Because sometimes you get an answer like, Tom said I'm alright, but John said I'm loose. Right? So maybe John is small. Right.
And we don't want to be carrying people to surgery for no reason.
So you don't want to do it for no reason. But there are surgical procedures where what you really actually do is bring the pelvic floor muscles together. You shorten them and bring the vagina. So the same muscle that you would have used Kegels to tighten up, you shorten them. So if you shorten them, you'll make them tighter. It means that they could stretch again, right? Or they could be scarred. And when they become scarred now, then you get very painful intercourse rather than very loose intercourse.
Right.
So you have both sides of the coin.
I have a few more scenarios to throw at you. So, I'll ask that one last. What I'll ask you next about is a condition called vaginismus. So in my medical school days, I remember people cracking jokes about people having sex and the man penis gets stuck in her because she clamp upon him and them have to go to the hospital together and go to be separated. Now, explain vaginismus. Is it real? Could this really happen that you have to go to the hospital?
I've heard about that.
Like how the dogs them.
I've heard about that many times. I've seen it all in the Star some years ago.
Yeah, it would be in
but
the Star.
I have never ever seen anybody, female and male, stick together.
But they wouldn't come to your office. But maybe I'd probably rather come to the office than the hospital.
Because what happened with the dogs, when the dog having intercourse, the head of the penis get
so engorged, yeah.
Yes, and get big, so it doesn't come out very easily until it is limp.
Which is probably nature's way of ensuring that all the semen come out too. Maybe
or stays
inside.
No, vaginismus, it is not a thing about sticking as much as a thing about not being able to penetrate. Because the levator muscles around the entrance of the vagina, that bring me back to my analogy between the two gates. You have a little gate and you have a big gate, but inside the vagina is the same vagina. So the person with the little gate, if you just put your finger, a lot of people have vaginismus, and you touch them. You don't pass the instrument, you just touch them, and they're screaming, having pain, right? And if you just get the tip of your finger in, and you feel the edge of the levator muscle, it is so tight. Tense.
So is it really that this man then kind of just gets his penis just beyond the levator, and you're probably having some amount of intercourse with lubrication, but then you get stuck?
Yeah. Well, I don't say...
And the only way to come out is if you become anorexia.
I'm not convinced that people get stuck. I think a lot of it is over... is blowing out
dramatics for
entertainment value. But what usually tend to happen with vaginismus is, and vaginismus can happen even in women who have had children, is that the introitus of the vagina, which is the entrance,
right?
It is the muscles get so tense with either attempted sex or attempted examination that the person has excruciating pain. And so one of the treatment for vaginismus now, although it is people used to have an operation that they call Fenton operation, and they used to use that in order to make a T-cut and where in the entrance of the vagina. So although it is cut like a T, you close it the crossways so that it widens.
You widen it like
but guess what usually happens when it closes? It usually forms a scar, and sometimes matters get worse. So people have come up with this big idea maybe over the past 20 years, that if you inject some Botox in the muscle, then you will relax it. And what Botox does, as you know, Botox is botulinum
But
toxin.
I just think of it pouting things up, but it will relax.
No.
In this context, it
is
relaxes muscle.
Botox is botulinum toxin. I mean, it is produced by certain things like snakes, and when them hit you, it paralyzes the nerve. Now, the muscles that will contract at the entrance of the vagina, they contract because of the nerves that come to them, right? So in front, near to the clitoris, you have the pudendal nerve, and to the back, you get nerves that come from inside the plexus in the pelvis, right? And these will contract the muscles at the entrance. By the way, here they talk about the pudendal nerve. Pudendal nerve, just to tell you how people used to think of genitals, mean the nerve of shame. Right? And nothing is wrong, but it is the same nerve that gives most of the innervation to the clitoris that can cause pleasure, but it was named the nerve of shame.
Oh boy.
Right? So,
and that is some history right there.
That is some history, but back to your vaginismus. So I've seen vaginismus.
So what about the psychological component of vaginismus? Because my understanding is that you're anxious or nervous, so you tighten up.
That is
so
it.
That is kind of what I think of when I...
Most vaginismus. Sometimes I don't find any underlying cause. But if you take a good history, a girl had some interference when she was younger and she carried with her
right, I
for
was
many
wondering
years.
If maybe abuse or rape could be
Sometimes they don't even succeed. But I have seen the extreme now where a man was married for 6 years and was unable to get intercourse from his wife because of vaginismus, not because she didn't have a passage.
And he may not have known that before getting into that sexual situation.
No, because they were two upstanding people that planned that they would have sex
after
before
marriage, right?
Before marriage, yes.
All right, we're coming close to the end now, and I'm going to ask you a very interesting question to almost wrap up, and then we're going to conclude as to whether all vaginas are created equal. But does vaginal tightness matter for lesbians? I mean, and that's assuming that
it might, and like the question.
Well, that goes into the whole story of lesbian intercourse and what they do.
Yes,
in
I have had.
So it depends.
I have had very good discussions with women who hate to be called lesbians. They tell me when I say things like that, I should say that they are in same gender relationship.
Okay, well that's more politically correct.
Of course, it is all right. And they say that you should say homosexual because not all same gender relationship have sex. All right.
Okay, for this, all right. So that's the addition of the sexual.
So that is
but correct me if I'm wrong. Homosexual, as far as I know, includes male and females.
Yes. So long as you're in the same.
And gay as well, but are gay usually we associate with men.
We associate gay with men.
But I think it is still all encompassing.
Homosexual mean lesbians and
because that's
and
coming
gay.
from Homo sapien.
Yes. So it means that, however, female homosexuality is far more acceptable in our society than male. That's number one. But number two, people do not know that a lot of female homosexuality exists. Because if you should just go to a girls' school, girls walk and hug up and hold on.
But a lot of that is not homosexuality.
No, it isn't.
That is just female bonding
it isn't.
in high school.
So when it is, you don't recognize it. While guys...
We don't do that at all.
Yes, you don't do that. And when you see two guys riding on the street in the bike,
you can't put your hand on the man who is in front.
The girl, when they're on the pillion, they hook up the guy. The guys fold them arm or put them hands behind him. And so when the bike man hit up a toll, them drop and bust them in. Right? And because they're not supposed to be hugging around the men, I will at least make people see. Right? So you find that all of that. But back to your question. Females do use sex toys for penetration, but there are quite a few females who are in same-gender relationship who are virgins, so they don't penetrate.
Right.
But remember that a lot of sex toys, they don't come looking like penis.
Right, not everything is penetrating. Some things are external stimulation.
There are vibrators that look like an egg.
Well, I think I'll have an episode
and because it look like
people who tell us what happens.
Because they look like an egg, what you do, you turn on the current,
And you put it on the clitoris.
And you rub it all over the external area, clitoris and labia minora, and people get pleasure and get climax. So it doesn't always, is men believe that penetration is such a big deal. Women will tell you that they can masturbate themselves and get them climax without penetration. Right? So when you talk about same-gender female relationship, a lot of them do not use toys to penetrate. Now you have some now who have on belt and penis.
Right.
And so the person who at the receiving end, they feeling it, while the one who belt it on, you don't have no sensation.
It sounds like we may have to bring you back for this for another episode.
I'm sure there's going to be algorithm, and there is going to be artificial intelligence that's going to make dildo have sensation one day.
Well, we were talking about this in a conference today, and I'm sure the dildo will be able to predict exactly what you need, just like Google and Gmail does.
Exactly.
All right, so as we recap, you can add anything that I've left out. So things that may make the vagina loose, potentially having a lot of children, menopause. These are the things that may loosen the walls a little bit, potentially.
Well, first thing, you can get congenital abnormality where you're born and the vagina just don't form at all.
Fine.
Right? So you have a normal looking clitoris and you only have the urogenital ridge where the vagina turn in from below, but the opening from top don't come down and join it at all. So you have imperfect hymen, you have vaginal septum, you have septums that are vertical, like the septum between your two nose holes. So it goes straight up from the entrance to the cervix. And I remember a patient of mine who wasn't getting pregnant, but when she was having intercourse, the septum get pushed to one side, and all the intercourse was
going
taking
to the
place
side that
in
wasn't
the
going
dead end.
into the dead end, get all the semen.
So we removed the septum, and she has had 3 children since, because the cervix get them. So they all are not created alike, but a lot of time you do not find out that there's an abnormality until around the time that the person should start menstruating,
then, probably having sex or trying to have a baby,
So there are, because of the development from a couple ducts, these ducts do not necessarily hollow out and do not form properly, and these are congenital abnormality. You're just born that way.
Right,
and this is what people say, you're a eunuch.
So all vaginas are not created equal if we include congenital abnormalities. In the absence of congenital abnormalities, though, what you would say?
Basically the same. And a lot of things in your head rather than in your vagina.
Oh. Well, I don't think we need to talk anymore about this. I think we have exhausted this topic, and I think that you've learned a whole lot about female anatomy, about vaginas, and so many different scenarios around whether vaginas are really created equal, and it seems like they pretty much are. So ladies, do your Kegels if you want to tighten up, and let me know how it is after 3 months.
But ladies believe their vagina is different.
And I think all ladies believe their vaginas are tight.
Not only tight, but believe they have something that different from everybody else. And so long as you get it, you will never leave. That is what they think. As
Shireen Anderson said, I have to come back. All right. I thank my father, an obstetrician gynecologist, Dr. Wendel Guthrie, for doing my first full-length podcast right here on Talk Truth. I would not want it any other way, and I'm sure this one will go down in history. I'm also sure that he will be back for some other topics because he's a wealth of knowledge. So this is where you have the fake applause in the background. I'll probably try and put it in after. So thank you for staying tuned right here on Talk Truth, and more to come next week. We'll see what's up. Something spicy. Bye. If you heard anything in this podcast that resonated with you medically, feel free to make an appointment to see either Dr. Guthrie as a gynecologist or to see me as a general practitioner by calling 876-929-2311 to 2 or 5. That's 876-929-2311 to 2 or 5. Feel free to make an appointment. Well, that podcast was either very awkward or highly educational and maybe a bit entertaining. But whatever you got from it, I want you to also realize that it's also awesome to have a great relationship with your parents if you do. And I truly appreciate that I can sit down and have candid and open conversations with my pops. So, we give thanks for him. And to you, our new and loyal listeners, you know what to do. Subscribe to the podcast, download the podcast, stream the podcast, share the podcast on social media and with your friends. What you can do when you're sharing is at Mario Evon, that's MarioEvon, and use the hashtags TalkTruthJA and MeTalkTruth. You should also please give us a review on iTunes, as iTunes ratings really help to bring us up in the podcast listing. Ratings, give us a 1 to 5 star, whatever you feel we deserve, and write a comment. Let us know if you like it, if you don't like it, if you feel it, if you vibe it. So whether you have an account or not with iTunes, jump in there and give me a review. For people on Twitter, we're at TalkTruthJA, and you can send us an email at talktruthja@gmail.com with any questions or feedback. We also have a guest link. So if you think you have truth to share, feel free to link us up for the link to our guest link, and we'll send it to you. This has been episode 2 of Talk Truth. Next week, more juicy things. This is your boy, Mario Evon. Blessed love. Until next time.